Odds, maybe. You can see a few people. Yes, perfect. Okay. Hi, everyone. Welcome to our quarterly webinar. This will be a very exciting and very interesting discussion, and I'm glad so many of you were able to join us. I am Sue Williams, the CEO of Children's Trust, and we have a great lineup for you today. But before we get started, just a few quick housekeeping reminders. One, this event is being recorded and will be shared with all of you in a follow-up email if you registered, or if you know of others that registered but couldn't make it at the last minute. Please rest assured them that this will be recorded and shared. Second, only our panelists will appear on audio and video today, which means that the attendee video and audio have been disabled. But that doesn't mean we don't want to hear from you. So please use the chat feature for questions and conversations during the event. Say an amen or yes ma'am or way cool or whatever. We want to hear from you. So let's get started. We only have an hour and we have a lot to discuss. First of our two panelists is Senator Katrina Shealy. Senator Shealy was elected to the Senate in the November of 2012, and at the time was the only woman in South Carolina Senate, where she is now one of 5. She serves as the chairperson of the Family and Veterans Services Committee, is a current member and past chair of the Joint Citizens and Legislative Committee on Children, and is the chair-elect for the National Foundation of Women Legislators. Woo-hoo. Senator Shealy established Katrina's Kids, a nonprofit to serve children in the foster care system. She really is, as her Senate colleagues call her, the Senator for Children. Joining Senator Shealy is Representative Spencer Wetmore. Representative Wetmore was elected to the House in a special election in 2020, but she is no stranger to these issues. She has served as a prosecutor for the Charleston County's Solicitor's Office and as city administrator for the city of Folly Beach. She's a graduate of Princeton University and Vanderbilt University Law School, and Representative Wetmore returned home to serve the Lowcountry. Thank you so much for both of you being here. And now I would like to introduce our moderator for the panel is Dr. Arlene Andrews. Dr. Andrews is a distinguished professor emerita in the College of Social Work at the University of South Carolina with extensive experience as a community psychologist, nonprofit leader, and board member. Dr. Andrews has previously served in a variety of key roles, including the founding executive director of Sister Care, founding executive director of Prevent Child Abuse South Carolina, and as a board member of multiple community and regional organizations, including Children's Trust, where she is the chair of our policy committee. She also served for 8 years on the South Carolina Joint Legislative Committee on Children and Families when the Children's Trust was first established in 1984. From her perspective, though, she says most importantly, she is a mom and a grandmother. And with that, I'm going to turn it over to you, Arlene.
Thank you, Sue. And let me say thank you not only for being here today, but to all the staff of the Children's Trust for all that you do every day to protect children and promote strength and resilience in our state's families. And to our audience, on behalf of the board, I say welcome and Happy New Year. It's our firm belief that everybody in South Carolina has something they can do on behalf of the children of the state. And our board is eager to do our part in 2022, and we're ready to go. And of course, to our panelists, Senator Shealy and Representative Wetmore, thank you for being here today, but also thank you for doing your part and always leading on behalf of South Carolina's children and being sure that they are a priority at our General Assembly. And with that, I'd like to get started by asking our panelists about some of the policy issues that are active. And for those of you in the audience who may not be familiar with South Carolina's legislative system, this is the second year of a 2-year session. So the work that's being done in the legislature is continuing from last year. And so some of these things are in mid-progress. And one of the ones that is getting so much attention these days is paid family leave for state employees. In March of 2020, Governor McMaster and a bipartisan group of legislators called for passage of a paid family leave bill for state employees that would grant 12 weeks of paid family leave. Following that press conference, bills were introduced in the South Carolina House and the South Carolina Senate. And thank you, Senator Shealy, you were sponsored one of those bills. Both of those bills have had hearings with the Senate version, which now stands at 8 weeks of paid leave for mothers and 4 weeks of paid leave for fathers. But it's awaiting a hearing in the full finance committee. The House's version, with the support of Representative Wetmore, has passed out of the House and includes 12 weeks of paid leave for both parents. So I'll ask you first, Senator Shealy, what led you to co-sponsor Senate Bill 11? And what do you think the final version of this policy will look like if it passes our legislature?
Okay, thank you. And first of all, let me thank you for having me here today. It's always a pleasure to work with Children's Trust. Well, what led me, first of all, to sponsor this is women in the workplace have been needlessly disadvantaged for years because we bear the burden of pregnancy, birthing, and caring for our children. I co-sponsored S11 because women should not have to choose between their jobs and raising and having a family, nor should they have to lose pay or go back to work sick because they have no leave to take. It is simply the fair thing to do. And considering the pay inequity between men and women in the workplace, it's the least that we can do. I think it may get tightened up a little bit more than where it currently stands to focus more on a single family member versus a set of both parents. But time's running short and we have a lot of pressing issues this session. And it may take a good amount of room on the calendar because this is the second year of a 2-year session. So I think that that's, going to be one of the issues. I think when, we get through, it may look a lot different than it does right now.
Representative Wetmore, you're currently mom of 2 children and a supporter of paid family leave. Would you like to comment on the bill as well?
Well, sure. The bill or, the idea in general, one of the reasons I ran for office is because I am a mom and, this is something that I take very personally. I myself was actually still am, I guess, in the legislature, but was a full-time state employee for over a decade. And in fact, when I had my daughter, my youngest Lola, Kate is 6 now, and was only able to take 5 weeks of leave with her because that was what I had and sick leave built up. So the issue is personal, and I certainly appreciate its importance to our families. I think, when we look at children and families, this is where it starts. And so this is a huge priority for me, and I think for all of us.
Well, and thank you both for supporting it. We had a question submitted from some attendees today, and so I'd like to pose that question now. The question comes from the Richland County Foster Parent Association, and it regards foster parents and paid family leave. As you know, there's a federal paid family leave bill for federal employees, and it includes foster parents. And in South Carolina, the original bills introduced in the House and the Senate included paid family leave for foster parents. But this provision was removed due to concerns that foster parents might have multiple foster placements in a year, and there would be potential abuse of the benefit. Senator Shealy, you supported the inclusion of foster parents in paid family leave when you co-sponsored the original bill. Do you think it's possible to restore the foster parent provision with a safeguard against these concerns that were raised about potential abuse of paid leave?
Okay, I need to clarify that because I supported the family leave bill, but I had a concern over the foster parent issue. And I did have that concern because a foster parent it's a completely different issue. I think that we need to look at that on a different type of legislation. When you have a foster parent, they can, you can foster 3 children at a time, and that could change in 2 weeks, or that could change in, 4 weeks. Where if you have a baby or you adopt a child, that's not going to change every couple of weeks. And a foster parent is paid for their services, where if you have a baby or you adopt a baby, that's a different situation. So I think it needs to be looked at differently because you're going to have a different physical impact on the state and what it's going to cost. So in order to get the paid family leave bill passed, at any level, we would have to take that out and look at that on a different, in a whole different scope. So I think that we can possibly do something with foster parents and paid family leave, but it's going to have to be looked at through a different lens.
Okay. Thank you for clarifying that. Yeah. I'm going to move to another topic, one that's sometimes difficult to discuss. That has to do with the earned income tax credit. Although, even though it's difficult to understand, sometimes it means everything to families when it happens. And just as background for the audience, in 2018, a study of families across the United States found that when the federal earned income tax credit began, it lifted about 5.6 million people out of poverty, including about 3 million children, and reduced the severity of poverty for another 6.1 million. As we know, growing up in poverty is a threat to healthy child development in so many ways. Inclusive poverty is related with poor academic, cognitive, health, and social outcomes. So it's one of the most, the earned income tax credit is known to be one of the most effective ways to address poverty. The South Carolina the legislature has passed a state income, a state level earned income tax credit. It was passed in 2018. And in that same year, over 59,000 families in South Carolina were able to claim that tax credit. By helping families keep up basic spending, the tax credits not only help families build economic security, but strengthen our whole state economy by keeping working families active in the economy. Next year, South Carolina's earned income tax credit will have a maximum of 100, of the value that is a maximum of 125% of the federal level. How can the legislature, it's a wonderful benefit for families, as we all know. How can the legislature be sure that every family that's eligible for the earned income tax credit knows about it and can claim it? Because apparently a lot of families currently aren't yet claiming it. What ideas do you have about that? Senator Shealy?
Several programs have seen, have seen success in marketing campaigns funded by the state. These campaigns can help get the word out about the earned income tax credit and who qualifies it and how individuals and families can claim it. But it's important for legislators to understand that. And like you said, the program incentivizes people to work. We could also look at the possibility of raising the cap beyond the 125% of the federal earned income tax cap.
Senator Wetmore, Representative Wetmore, would you like to add anything to that?
Sure. I think that one of, this is something that, of course, has come to a lot of the consciousness of a lot of families after the recent federal level tax payment was made automatically for the last few months to families through December. And so I think there are a lot more families that are going to be aware of it now than we've had before, right? I think a lot of times when it's just filed as part of your regular tax return, you may not fully know why you're getting, certain amount back or not. And so I think having seen this as a separate standalone thing on the federal level will help in and of itself to raise awareness. But, South Carolina actually has volunteer tax preparation assistance. I know that it's available. And I think really making sure that we are targeting our outreach towards families that are already receiving assistance, who may be, these working families that need a little bit of assistance with food and other benefits, may be an opportunity for targeted outreach on our educational programs. But, the main thing I really want to say about this is a lot of people may not realize that, as Senator Shealy said, this is something that South Carolina leads on. This is an area where our benefit is a good one relative to most other states. And our percentages are higher, and not all states even have this at all. And so you're exactly right that awareness is the key here. And, my hat's off to my colleagues for their work getting this done in the first place.
I'd like to bring up the issue now of our our Department of Juvenile Justice. All of us who pay attention to South Carolina news keep hearing, and throughout the fall, we particularly heard a number of disturbing reports. There was a staff walkout, a director resigned, there were poor facility conditions, there have been tragic reports of violence within the facilities. Acting Department of Juvenile Justice Director Eden Hendrick told state senators in October that DJJ needs to reform almost every aspect of what it is doing. Senator Shealy, you're a co-sponsor on Senate Bill 53, which is the South Carolina Juvenile Justice Reform Act. What are some of the reforms that you believe need to happen with DJJ? And how can the legislature ensure that they actually happen?
Well, first off, S53, it's a very large, comprehensive bill. It has so many working parts to it, and it covers so many different issues. But a couple of the major steps that the state can take in reforming DJJ, first and foremost, is raising pay and hiring well-qualified security staff. Now, the state has put a lot of money out there to hire these security staff. The big problem is these people aren't out there. You know, there's so many jobs in the state of South Carolina right now, and big companies are offering more money, and they're jobs that are safe jobs. You know, if you go to work for the Department of Juvenile Justice, right now, you're going in there with juveniles that are 6'4", they weigh 230 pounds, and 90% of the security guards at DJJ, the JCOs, are women. And they don't carry a weapon. They don't carry a taser. They don't carry a stun gun. And they go in there, and it's really hard for them to protect themselves. And so it's really hard to get people to work there. So we can raise the pay, but we have to get people over there first so people feel safe going to work there. But then we need to offer support services for these people. We need to offer support services for the children. You know, people say, I can't believe you call them children. Well, they are children. I mean, their ages 12 to 17. Yeah, this is one thing I am very passionate about. Somebody wrote me notes here. I don't have to read notes to talk about the Department of Juvenile Justice, but we need to offer them services. You know, there's mental health issues there. We don't need to send children to the Department of Juvenile Justice to get mental health, because it's not happening there. There is so many things that need to be done. You know, 4 years ago, when the previous director took over, it was already an issue. There was already problems, but it only got worse over the last 4 years. Well, when the interim director took over, there was already a really deep hole there that now we've got to dig out of that hole. And in order to do that, yes, we need to put more money out there, but they have a large reserve fund out there. We need to change the way it's structured. We need to revitalize those buildings out there. We need more programs for the youth, but we do have to get more security staff. We just have to figure out where they're going to come from. And if there's somebody out there that knows where to get these security people, we will welcome any suggestions, because it has been a very, very difficult task. And, you know, I think the interim director's doing a great job. I just don't think that there's no place to go right now. You know, she's borrowing people from the Department of Corrections. She's going to the local, you know, sheriff's department. She's trying to find people, but we need to find these people. And I don't think there's enough money right now to throw at that problem.
Thank you. Representative Wetmore, do you want to add anything to that?
Well, I think, you know, one of the things that I think is important, this is an area of passion for me as a former prosecutor. You know, it's back in college, I wrote my senior thesis on restorative justice for juveniles. So this is an area of passion for me as well. And I think it's also a question, you know, some of the staffing problems may not be solvable with the current setup, right? I mean, we've got a large facility. As Senator Shealy mentioned, we've got too many children committed in the first place to these facilities. And so I think as we look ahead to our capital planning in this area, looking at smaller facilities, more mental health special facility, either specialty beds or a specialty area within there, to make sure that we are providing the services in a smaller way, which I think will be safer both for the children that are there, but also for the staff members as well. And so that's one area. And of course, as we look at commitment numbers, increasing our community integration programs. We have a lot of incredible programs throughout the state that are working to keep children out of the actual commitment. And so making sure that we're continuing to shed light on those and to support those programs that already are out there, and helping people to minimize the commitment numbers overall. Those are the other ways we can sort of address some of these staffing crises that Senator Shealy's absolutely been a champion working with.
And we can tell how completely well immersed you are, both of you, in this issue, and we do appreciate that. I agree with you, Senator Shealy. They are children, and they do need all the support the state can get them. So, and you mentioned budget. With regard to that, we'd love to hear from you all on budget priorities for this year. Just 2 years ago, policymakers and the public were worried about what would happen with the advent of the pandemic and COVID-19 and some of the economic setbacks we had. But now it looks like South Carolina's revenues have remained strong, and things are looking even better than we thought they would be. In November, the South Carolina Board of Economic Advisors predicted that South Carolina would have almost $900 million in new recurring general fund revenues and over $2 billion in non-recurring revenue. Most of the $2 billion is from the federal COVID relief bills and is meant for designated areas. But the $900 million has fewer restrictions. We'd love to hear from each of you about what you would propose that the legislature use these funds for. And Representative Wetmore, why don't we begin with you, and then Senator Shealy, we'd love to hear from you as well.
I agree. Don't make me follow her anymore. She's the real expert here. So for me, it is mental health, mental health, mental health. That is a funding priority for me. I don't want to steal your thunder because I am jumping on the senator's bandwagon here. This has been something she has been calling for, talking with the governor for a long time, and I'm jumping on the bandwagon. But for me, that is the key. It starts in our schools with education, with the school counselors and the private organizations that partner with them to provide these wraparound services. We've got school organizations, communities, and schools, and just a number of them that are doing great work partnering with our school districts. It continues all the way through to DJJ, to our families, making sure they can see a doctor. Some of it has to do with Medicaid reimbursement for both in-school behavioral health and making sure that during the COVID period, we were giving equivalent reimbursement rates through Medicaid, but we're not anymore. And so taking a look, yes, we all agree it would be better to see the doctor in person, but are we able to get all the kids that need these services seen, without also relying on our telehealth and sort of virtual visits? So for me, it's mental health, mental health. I think that's the key to education, juvenile and adult justice systems, because these undiagnosed problems, I unfortunately spent a lot of years as a prosecutor realizing that this was coming from undiagnosed mental health, that leads to the drug problems. It leads to a lot of these things we see in adults. And so this is the key, is identifying it as early as possible and using our state resources in that way, I think.
Senator?
Representative Wetmore, I couldn't agree with you more. Mental health is very important in this state, and we definitely need to spend a lot of these resources there. I also have two priorities. It's the extension of foster care to age 21. I have a bill S-221, and then S-222, which is the kinship care. Both of these bills have passed the Senate. They're sitting in the House waiting to be passed. I hope that the House will make these their first priority when they come back. These are reoccurring items. And, we've got, 900 million in reoccurring funds out there. These can be funded. this year, and we need to do that. These are very important. These, we think about it, foster care ends at what, 18? When we were 18, were we ready to go out into the world? No, we weren't. We all had good families, and, some of us still depend on our parents, so, and we're way past 18. And then the other one, the kinship care. If you take a child into your home and you're the aunt or the uncle or the grandparents, you need to be supported just like a foster parent. And so these are two bills that I've been fighting for a couple of years now. They passed the Senate, 40 something to nothing. Let's get them out of the House and get them passed. As far as the one-time money that we've got out there, we have a lot of deferred maintenance on state buildings at DJJ, DSS. DSS has got some buildings that are, in dire need of being upfitted, and DJJ, Lord, we know that that's a mess. So we need to, do what we can do in both those places. So that's where I think we ought to spend our money.
Okay. And going back to the mental health issue, let me just say that we've had a number of audience comments submitted for this session, as well as currently in the chat, agreeing that this is a critically important area, as well as the issues of foster care. And do you think there's any way to increase the Medicaid reimbursement with regard to the kinds of mental health services that are needed by children and their parents?
I do think that, we had a policy that we had the no eject, no reject. We used to have that no eject, no reject beds, and we did away with that. And that's a problem. So we have been talking with the Department of Mental Health, the Department, DHHS, and to get that mental health bed reimbursement increased. And I know that that is a thing that's in the works. That needs to be done because children need a place to go. We need to quit shipping South Carolina children out of state and taking out of state children to fill up South Carolina's beds. So that is something that we're working on. And I think that we will accomplish that this year.
Do you think there's any way to expand or create ways to improve community-based assessments of children with regard to mental health needs, so that we aren't as dependent on beds or facilities?
I mean, yes, I think there's a way to do it. We just need to work harder on that. We need to find a way to, we did away with all our mental health facilities. The state did. We don't have mental health facilities, and we're dependent on schools to be our mental health, our source for mental health. And we need to change that.
Mm-hmm. So we agree. Representative Wetmore, would you agree with that?
Absolutely. And I think that's something, I was fortunate enough to be a healthcare policy fellow this year. And this is an issue that we've been talking about a lot is, we've got a limited Medicaid budget, but this is where a lot of our children are, this is the reimbursement rates. And so using these community-based evaluation and treatment is a cheaper way to accomplish that as well, than, rather than the full residential inpatient. So I do agree. I am certainly no expert on this. I am new and learning, especially when it comes to a lot of the financial issues. I'm proud to serve on the Judiciary Committee, and so I look at a lot of the legislation that comes through. But I certainly am taking notes here, both from what we're talking about here and from a lot of the comments from the panelists today, as to sort of some of these ideas about this community evaluation and home treatment. So I appreciate all of that feedback.
We also, in the line of mental health, we've had questions submitted with regard to gun safety, and we've seen an increasing number of suicides among children and youth, as well as unintentional injuries, and then of course homicide related to use of guns. We just are seeing a steady increase of firearm injuries and deaths among our young people. What do you suggest could be done to increase gun owners who are parents storing their arms properly and storing their ammunition properly, so that children are less likely to get access to weapons, and also so that children receive proper firearm training as they develop, so that we can potentially reduce some of these suicides and other kinds of injuries and wounds.
Okay, it doesn't look like Representative Wetmore is going to jump right in there.
No, go ahead.
Last month, I co-sponsored a bill introduced by Senator Talley, which would require schools to designate one day to allow certain civic organizations like Boy Scouts or Girl Scouts to come and talk to students about joining their organizations. And many of these groups, like Scouts, train young people in the safe handling of firearms, in addition to many other benefits. But I think firearm safety is something that everybody needs to train, teach their children. Everybody needs to be educated. And I think education is what's going to change that. I think, we make children scared of firearms, but we don't train them why they should be afraid of them. And so then they're curious. And when you're curious, you do things you shouldn't do. So I think education is the main thing in firearm safety. But now I'll turn it back over to the representative.
Well, and I was double checking to make sure I was correct about this, but the new open carry bill that was passed and made law this year, that is actually one of the additional training requirements as well that was added in there, is the proper storage, especially as it relates to accidents and children. And so I think that was a bill that I did not support, but a good part of that, because I felt like it was the training is the key. It is, and as we have concealed weapons or I guess now weapon permits, having that be a part of that standard training that people receive when they do, their 8 hours of training, I think is really an important piece of it, because, we all support the right to own them. And I think the key is making sure that we are also supporting and encouraging responsible ownership and use.
Well, thank you for those comments, because we've got to do something to turn that rate around, that increasing rate of injuries. So we have a question from the audience, directed for you, Senator Shealy. You're the primary sponsor for Senate Bill 222, which has passed the Senate and is in the House. It defines fictive kin as someone who is not related by birth, adoption, or marriage to a child, but has an emotionally significant relationship with the child or family. Why is it important for South Carolina to have this definition in our statutes?
I keep losing that mute and unmute button. Fictive kin is, that's the kinship care bill. Anybody that doesn't know the number, S222 is the kinship care bill. But fictive kin, which I never knew what that word meant either, is let's say that you have been going to church with someone forever and you don't have any immediate family. Me and my husband, we have our little daughter, little Susie, and she is her godmother, could be a fictive kin. And when, say we both got killed in a car accident and she became their foster mother, that would be a fictive kin. So that's what that definition is. Let me tell you how many times I had to explain fictive kin on the Senate floor. A lot, because it doesn't, I didn't know what the word meant either, but that's why that's in there. That's why that definition is also in there with kinship care.
Mm-hmm. Yeah, we've used it in social work.
Yeah, but it's not a common word on the Senate floor either. So,
okay, we have always a concern for our rural communities because they have so many special challenges in so many different ways. And we have a question from the audience about issues of job stability in rural communities and how critically important it is for families that live in rural areas, for the earners in the family to be able to count on a job and have economic security. The most recent NEKC Kids Count data shows that 46% of South Carolinians suffering from unemployment also reported that they have a child in the household, and that rural counties historically have much higher unemployment rates than their urban neighboring urban communities. How can South Carolina help its rural communities have good paying, steady, reliable jobs, and how can investment in rural economic development be enhanced so that families and children in those areas can have more stable reliance on jobs?
Sure. Yeah, so I can jump in to start. One thing I have learned in my limited time in Columbia this past year has been, I'm coming up on my year and a half here. So one thing that I've learned is that we do spend a good bit of time focused on our Commerce Department does an excellent job of economic development. South Carolina has been an incredible leader in this area, and I'm so proud of the work that they're doing. We are seeing new jobs coming up in Chester and Fairfield, and we're seeing great jobs down here where I am, and down in Charleston, we're seeing great things come. Berkeley and Dorchester County, which have been traditionally rural areas. And so the key is sort of to making sure that we're using our interstate system and making sure that we're using, that whole corridor there, what, has unfortunately been traditionally called the corridor of shame in relationship to education, making sure that we're connecting that entire corridor when it comes to these great, we're getting manufacturing jobs in, the port is helping us bring in great distribution centers. And so making sure that, we are connecting that manufacturing hub that we've done such a great job of building in our upstate and over all the way now into, Chester and Fairfield. And then connecting that with distribution and manufacturing all the way down, these interstates that we do have in place already. So that's my best estimate, but it's important. And of course, broadband is going to play a part in that, and making sure that our rural areas have broadband, not only just for job applications and education, but also for many of the jobs that are now remote. So I think those are the two things that I would offer.
So you mentioned broadband in particular. We certainly learned how critical that is to children's education, as well as for family members to be able to work from home. Issues like being able to get a medical consult in a rural community when travel's difficult or impossible. How far out do you think we are from having universal broadband across the state?
I can start, although Senator Shealy, I don't want to, if you have a better answer, but I know that we have our Office of Regulatory Staff, ORS, has developed a broadband office this past year, and I've talked with them pretty extensively about this issue of broadband. And between, the state has committed a tremendous amount of funding, and the federal government, both on various bills through the CARES Act and infrastructure, have also committed a tremendous amount of funding. I don't remember the numbers off the top of my head, but we are putting a substantial dent in it this year. And I honestly, every question that I had about affordability and providing it in our rural co-ops, we had an answer for through our Office of Broadband. So I don't want to put a time estimate on it, but I am very proud of the work that we're doing in this area.
We have another question from the audience. Has to do with early childhood. Early childhood is a critical time for brain development, which determines how successful children will be in school and in life. Is there any legislation proposed to increase or improve early childhood education? Senator?
I'm not aware of, I'm sure there is. I'm not on the education committee, so I haven't read everything that's been introduced this year. Senator Hembry is the chair of education, and there's always lots of education bills. So probably Children's Trust would know better than me what education bills have been introduced so far this year. I'm more on the saving the children that are lost in DJJ and DSS, but every year there are, plenty of education bills, introduced. And, I've been hearing, the K through 12 teacher bills, that what they want, but I haven't heard anything specific to the early childhood education that I'm aware of.
A Representative Wetmore?
I honestly was going to say the same thing. I know that we've talked funding. We had an expansion of 4K, although of course not full, but an expansion of 4K. I know that we had several budget items that were looking at 3K and 4K programs, but I'm sorry to say that I'm not really able to offer any specific legislation other than that it's been a priority for the governor and both our House and Senate Finance to be looking at early childhood education. I do think there's a recognition of that importance. And I am taking notes here today because I think a lot of this is a learning and priorities emphasis for me as well.
Well, and two, with that, the budget situation we have this year, it may be a good time to up that investment so we can try to make pre-K and other kinds of early childhood programs universal. I'm looking to see, I think I have at this point exhausted the questions that we have, but we would love to have each of you let us know any additional things that are on the agenda for the legislature, or any advice that you may have to us as citizens of the state regarding things that we can do to help advance the lives of children. And Senator Shealy, could we hear from you first, please?
As always, I'm working very hard on all issues involving children. We're working closely with DSS and any issues that they have that can help with their funding and make their, they're still struggling with the Michelle H. lawsuit. So we're trying to help them, with the financial end of that so they can move forward with new issues. And, I think the director there, Director Michael Leach, is doing an excellent job. We've moved way forward since he's been with us, and, we appreciate the job he's doing. And, they have a great staff in all their offices. So we appreciate that. And Amanda Whittle is doing a great job at the Office of Child Advocate. So we have a great group of people working with us. At the Department of Juvenile Justice, we have a long way to go, but we're going to work on some legislation this year. We're going to try and break down that, I think it's S53, the big omnibus bill, and take pieces and parts of that. And, I need to talk with Senator Malloy about that. And let's take some parts out of that we can work on and get passed quickly, because anytime you have a huge bill like that, there's always going to be somebody that doesn't agree with just one little part that's going to keep the entire bill from being passed. So let's take the important parts out of there and get something out that can help children right now. And so I've already talked to him about that. So we're going to go ahead and start working on that. Other than that, I work on things with the elderly and veterans. So there's a lot of moving parts in my office right now. So we're going to work on all those things this year. But as always, children are the forefront here in 303. So we're going to get as much done as we can this year.
Good to know. Representative Wetmore?
Well, sure thing. So, as the person who was most recently just a citizen on, and probably y'all are all such accomplished folks that have been involved in this so much longer than I have. I will say that for me, my biggest learning experience has been, this urge, this desire to sort of drink the ocean, right? There are so many issues, and there's such a, on every front, from the environment to education to children. And so what I would say to those, on here today, and the folks that are so passionate about these issues, is to help us help South Carolina. We are being pulled in 20 million different directions. And so to the extent that, I get a lot of emails like, hey, can you look at this issue, or can you broadly consider this, right? I think what's the most helpful for us is when somebody, thoughtfully studies a solution and comes to us and says, hey, what about amending section 47 to include or promote this, right? Because some of the smaller changes, you can't make all the fixes that you want to. You can't come in and do everything that you want to do. And that's unfortunately just the sad reality. So we're going to have a few big priorities, big changes to education and big things. And then we're going to have some smaller bills that come through. But to the extent that advocates and organizations can work together to come to us with 4 or 5, changes that may be smaller in nature that we might be able to push and say, hey, this is a small change, and to really help us focus on what it is, what section it is and what the language would be. That's the best way that I think you can help us help the state. Because, for us, it's, I don't think I ever dreamed of how inundated we would be and how many different directions we'd be pulled. And so, and not to mention trying to be a mom and practice law at the same time, right? So, helping with the most specific feedback and outreach and advocacy that you can offer, I think is my biggest ask and hope for everyone that cares so passionately about these issues.
Well, let me say thank you to both of you for both the vision that you have on behalf of all children, and Senator Shealy, your passion for those who are most in need, and as well as the children all around the state, and Representative Wetmore, your vision, and both of you are so pragmatic about the realistic things that we can actually accomplish. As a board member at the Children's Trust, I'd also like to thank you for the support that you give to the Children's Trust and for having confidence in us. And we will continue to do our best to assure that the Children's Trust can be a part of finding solutions to challenges to our children. And also, as our focus is on the primary prevention, trying to get to ward off problems before they evolve, so that our families are strong and our state is strong. And so with that, I will look back to you, Sue, for any closing remarks that you may have.
Thanks, Arlene. And thank you, Representative Wetmore. Thank you, Senator Shealy. I just wanted to highlight a couple of comments. I know when you're doing these webinars, it's hard to manage the chat. So one from Amanda Whittle. Thank you, Senator Shealy, for discussing our placement array. At any given time, there are approximately 15 to 20 youth who require both detention and inpatient mental health treatment, but there are insufficient mental health placements for these youth. We need a state-operated psychiatric residential treatment facility. The last one in South Carolina closed in December 2015. That's just one. Director Mike Leach said LEEPCs children with mental health, behavior, emotional needs, and risk behaviors into foster care, and there may not be abuse or neglect. Urgent need for RVHS redesign. DHHS is working on this. And so many more. People were really excited about this topic. We had over 100 people who tuned in today to hear what you had to say. Our hope in doing this was to highlight that children are not red or blue, that it takes all of us working together to come to a solution for what we want for our children today, because they will be South Carolina tomorrow. We say that all the time, the children today, tomorrow, but if we don't address these issues today, then we will continue to have these problems into the future. So I sincerely appreciate both of you coming on and sharing your vision for the children of South Carolina. Thank you, Dr. Andrews, for your great moderation. And as everyone said today, Representative Wetmore and Senator Shealy, they do want to hear from all of you who were here and those that you know that couldn't be here today. It takes all of us, including not just the legislature, but those of us as citizens and the nonprofits working together to make South Carolina a better place for children. A special thanks today, a quick go out to Philip Cease, our Senior Director of Policy and Advocacy at Children's Trust, and Ms. Shealy Reibold, the Senior Resource Attorney for the Joint Citizens and Legislative Committee on Children, for helping us organize today's event. And as always, many thanks to our generous donors who support us doing this work. You too can help support our policy work by donating to Children's Trust using the link that you'll see in the chat. And you can also sign up for our policy post to stay up to date on the issues discussed here and throughout the year. So that's it for today. I hope you all have a great day and a strong and healthy start to the new year. Thank you all so much.
Sue, before you hop off, can I ask you a quick question?
Sure.